In any Alleva versus Behave Health behavioral health EHR comparison, the wrong platform can slow admissions and leave revenue on the table. Choosing the right EHR for your behavioral health organization is one of the most consequential decisions you can make. So how do these two platforms compare across the systems your organization actually runs on? This guide breaks down the key differences across CRM, EHR, RCM, and overall platform scope, so you can make an informed decision. Picking an EHR is not just a feature checklist. It is the system your whole operation depends on. Alleva appears to focus primarily on addiction treatment facilities, with clinical documentation and patient engagement workflows for treatment centers. Behave Health serves a much broader range of behavioral health organizations, from detox and residential to outpatient counseling and recovery support. A platform built for a narrow segment may lack the flexibility you need as your organization grows. The wrong platform can slow admissions and fragment clinical workflows. Leads slip through the cracks, and clinical-only tools leave billing to a third party, creating gaps that cost time and money. Here is the biggest difference. Behave Health combines CRM, EHR, RCM, and ERP into a single platform. Admissions, clinical documentation, billing, and operations all live in one system. That is designed to reduce integration headaches, data synchronization issues, and multiple vendor relationships. Alleva appears to be a more focused platform that may require additional tools to cover the full operational scope. Let us walk through the 4 areas where these platforms differ most: admissions, clinical, billing, and operations. Area 1. Admissions and lead management. A strong CRM is the foundation of a healthy admissions pipeline. Behave Health includes online patient applications and instant verification of benefits at the point of inquiry, plus lead management, referral source tracking, real-time census, a patient portal, and alumni tracking. All of it is included at no extra cost. There are no add-on modules or per-feature charges for CRM. Area 2. Clinical documentation. Both platforms are designed to support documentation, but they differ in depth. Behave Health includes ASAM assessments, COWS and CWA withdrawal scales, group therapy notes, and individualized treatment plans. It also includes e-prescribing via Doctor First, drug testing integration, and MedPass workflows for medication administration. These tools are built for the full spectrum of behavioral health operations, including detox and residential. Area 3. Revenue cycle management. This is where comparisons often reveal the sharpest differences. Behave Health includes eligibility verification, claims submission to payers, and ERA and EOB processing, plus denial management, appeals tracking, and patient responsibility and payment tracking. Alleva's billing may be more limited, and organizations may need third-party software, creating data silos and added overhead. Area 4. Operations. This is one of the most significant differences between the two platforms. Behave Health's ERP includes property management, HR tools, vehicle management, and maintenance and operations scheduling. Alleva does not appear to offer operational management tools beyond clinical and CRM functions. Behave Health is designed to support organization types that many competitors do not address at all. That includes recovery residences and sober living homes with bed and property management built in. It also serves drug courts, recovery community organizations, and NARR affiliates. If your organization falls outside the traditional treatment center model, Behave Health is built to fit without workarounds. If you are a current Alleva user weighing a switch, Behave Health provides a structured migration path. Our team handles data migration, staff training, and parallel go-live support. The goal is a transition that does not disrupt your operations or your revenue cycle. Stop letting the wrong platform slow admissions and leave revenue on the table. See how an all-in-one platform compares at behavehealth.com. Schedule a demo to see CRM, EHR, RCM, and operations end-to-end. Book it at behavehealth.com.